Good evening, and good evening. Oh, I have missed you all. I hope you have been having a wonderful day. And as we do in each of our videos, we're going to give you about 10 seconds before we get started with Monday Night Live. That is right. We're going to cover 50 multiple choice questions to help you pass your CNA examination. And I already see Landu and Van in the chat. So hello, everybody. Welcome in. Hey, Jonica. All right, everybody. Guess what? Yes, you all. You can use the QR code that is on your screen right now in order to purchase our new CNA Exam Prep book. You all, it took so long to finish this book only because I tried to outsource it. I tried to let someone else do the formatting, so they didn't do a good job. So with that being said, I had to write it. I had to format it. I had to publish it. So yes, Florida Training Academy officially is a publishing company, because what we're not going to do is we don't accept excuses. It's either going to get done or it's going to get done. And so I need to make sure that our babies, our students, had a good resource for them to pass their examinations. And so this is an easy to read guide. It includes clinical, it includes written, it has medical terminology, and even includes a practice test. So there's no reason for you to fail the CNA test. Just scan the QR code that's on your screen and you can be a part of our family. That is right. So, hey, everybody, I see you joining. Let's talk about our channel members. Yo, it has been a week. Let me tell you, this week, this whole month has been monthing. And so for our channel members, guess what? My team and I, we have been working behind the scenes to come up with so many different digital downloads for you all. And so you should have gotten these slides to this test. So I expect for you to receive 100%. You're supposed to answer every question correctly because you got to see the questions. You get to download and practice with them even offline. So it's one thing to have me going through the questions with you, but it's another when you're with your cohort, your students, your family, and your friends to be able to practice questions too. And so if you haven't logged in, what you're going to do is you're going to look at the comments inside of the YouTube channel area, look at the comment, and you will see a link, and the link will actually take you to the actual questions so you can practice in your free time. All right, and I'll start looking at the comments in one moment. All right, we're not going to show that just yet. Let me look in the comments. Let me see what you all are saying. All right. Hey, congratulations on passing your clinical. So proud of you. A lot of you all have passed your exams. Hold up. It's so many of you. I am so proud of you. And you've passed your exam too. I don't want to mispronounce your names. Tindonge. I'm so proud of you in Delaware State. Let's see. Constantine says, I took my exam last Friday and I passed it. Your video was helpful. You are so welcome. We're going to help some more babies pass their exams today. And so that was Okafor. Okafor, I'm so proud of you, girl. All right. And so I passed my exam last Friday. Thank you so much. And we're going to get started. Hey, so many great comments are coming through. So let us help someone else pass their examination. And we're going to get started with question number 1. Again, I am so proud of you all for all that you do and for keeping us posted on your accomplishments. All right, question number 1. A patient is sobbing. What is the best thing for the nursing assistant to say? A, stop crying. B, cheer up. C, don't be a baby. D, you appear sad. Hey, new family member. Let's see. Go ahead and put those answers in the chat. What do you think? And this one's an easy one. We're starting off really easy for you all because communication is vital if you're going to be in healthcare. And so you're not going to tell someone to stop crying. You can try to maybe do something to help them cheer up. But what you're going to do is you're going to communicate with them and you're going to say you appear sad. And so, yes, it is deep. Acknowledging a patient's emotions shows empathy and encourages communication. The other responses dismiss or invalidate the patient's feelings, which is unprofessional and not therapeutic. So anytime you have a question that's dealing with communication, remember that as a healthcare provider, as a CNA, we do more listening than talking. And so when you say you appear sad, you can wrap that up with, is there something you want to discuss? Is there something I could do to make you feel better? All right, let's go to question number 2. A patient has had hip surgery. Her leg should be A, abducted, B, adducted, C, elevated, D, in the most comfortable position for the patient. That's right. You may end up working on an orthopedic unit and you'll be taking care of someone after they've had a total hip replacement. What position do they need to be in? Hey, Nene. Nene says A. Let's see what other responses we have. We're all around the world on this one. Let's see. Josephine says C. Looks like Sia says D. So we are torn between D's and A's. And guess what, team? The A's have it, abducted. So think of something being taken away. Whenever, unfortunately, a child is abducted, they're being removed, they're being taken away. And so whenever someone has had hip surgery, we don't want those legs to become contracted and being stuck together. And so this pillow, this device that you see, is called an abduction pillow. And so after hip surgery, the legs should be kept in an abducted position to prevent hip dislocation and to promote proper healing. Question 3. A patient rings for the bedpan while visitors are in the room. The nursing assistant should A, wait until the visitors leave, B, give the bedpan to the patient in front of family, C, ask the visitors to leave the room during the procedure, D, ask the supervisor what to do. And this is going to happen often. The patient's going to be saying, hey, I need to use the bedpan, and the cousin, mama, sister, and brother are sitting at the bedside. That's right, everybody. Debbie and Danielle, we're going to have to ask for them to leave the room. Come on, we have to actually provide privacy for our patients and our residents. So the correct response is going to be C. Ask the visitors to leave the room during the procedure. Maintaining patient privacy and dignity, they are essential. So politely asking the visitors to step out ensures that the patient can use the bedpan in privacy. I'm so proud of you. Let's go to question number 4. A patient complains of pain. A nursing aide who has completed the basic certified nurse aide course should A, get the patient some pain medication, B, call the doctor, C, tell the med nurse, D, tell the patient to tell the med nurse when he or she comes in. Couldn't trick one of you all. So Larimar, Paris, Marie, Danae, Jay, yes, it's going to be C. How does the med nurse differ from your regular nurse? Well, whenever you're working in a nursing home or assisted living facility, sometimes they're going to have delegated people to give medications. For your test, this really doesn't exist. Like when you take your CNA examination, everything's going to either be nurse or charge nurse. But in reality, when you're working in a facility, you can have your med nurse and a charge nurse. So if your patient's in pain, that is something that you would relate to the med nurse as well as the regular nurse, because, hey, you want to make sure that the regular nurse knows that your patient received pain medication, and we don't want any lapse in communication. But that is the difference between the two. Just depends on where you're working. In a hospital, we don't really have med nurses. Your primary nurse gives the medications. Let's go to our next one. Question 5. Which of the following should be reported immediately? A, a blood pressure of 90/40. B, a pulse of 90. C, respirations of 12. D, temperature of 99.4. I'm so proud of you all for studying with me on a Monday night. We're going to pass these examinations. And next stop, nursing school, physical therapy school, respiratory therapy school, phlebotomy school. Like, go ahead. Once you give me the answer, put in the chat, like, what are your goals? What do you want to be when you grow up? All right, so let's see. Is it Angela M? So, hi, Nurse Eunice. Because of your help and videos, I passed my knowledge test for my final attempt. Whoop, whoop. Hey, I'm so proud of you. Congratulations. All right, everybody. So encouragement. So that's probably 10 of you have passed. And we've only been doing this video now for about 10 minutes. So everybody, for question number 5, what are your answers? And what do you want to do after earning your CNA license? Look, the sky is the limit. And so for question number 5, yes, the answer is A. A blood pressure of 90/40 must be reported to the nurse. Why? Because it is significantly low and could indicate a critical condition such as shock or internal bleeding. It must be reported immediately. Keep the patient in the bed. Go ahead and call for the nurse while the patient's in the bed. Do not leave that room. Question 6. How do you like phlebotomy, Blessing? All right, question number 6. A patient known to have Alzheimer's disease tells the nursing assistant that she smells smoke. The nursing assistant should A, reassure the patient that there is no fire, B, tell her that no one is allowed to smoke in the building, C, look around for the fire, or D, put the patient to bed because she is clearly tired. And while you're answering that, all right, so Blessing, again, that is phlebotomy. Nene wants to become an RN. And here, you're going to kill me. I'm just going to call you Annie. Annie's going to do the LP and RN bridge. Girl, that's an easy route to go, the easier route to go. So you all remember, the race is yours. You don't have to go straight to RN school. You can do LPN to RN. You can make more money along the way. And those facilities have tuition reimbursement. So you can get those facilities to help pay for your schooling. Oh, someone has to go back to work. It's okay. You can always check us out later. And then Will and Shauna, you're here to test your knowledge. So everybody, the answer to question 6 is C. Look, I have had confused patients who would tell me things such as, I have to go to the bathroom, or a confused person who would tell me my arm hurts. And then the one time I disregard that comment, it's like, oh, that's just Miss Lucille. She's confused. When I pull the covers back, her arm is swollen. And so you don't ever want to discount what your confused patient says, even if they have Alzheimer's, because they could have a moment of clarity. And so this person smelled smoke. You should do C. Look around for a fire, because while the patient may be confused, safety is the priority. Investigating the source of the reported smell ensures that the environment is safe. So even your confused patients can sometimes be right. And so just take a few extra seconds and actually research. Number 7. An aide is pushing a resident down the hall with a wheelchair. When a call light lights up, the nurse aide should A, continue pushing the patient and assume someone else will answer the call light. B, take the patient inside the room while answering the call. C, put the patient back to bed and then answer the call. Geez. D, push the patient to a safe place, apply the wheel locks and answer the call. Yeah, that was a lot. But when you're working in these facilities, especially at night, they're severely understaffed. And so it may be you and one LPN, you and one nurse. And here it is, you're trying to wheel someone and the phone's ringing. What's going to be the safest for that patient? And that is right, everybody. I got so many D's. Yes, it is going to be push the patient to a safe place, apply the wheel locks, and then answer the call, because safety of the resident being transported is crucial. Securing the resident before addressing a call ensures both the patient in the wheelchair and the patient needing assistance are cared for properly. And I didn't turn on my camera because it causes a delay, and I didn't want any issues with tonight's live stream. So question 8, Trays have arrived. Before serving each tray, the nurse aide should A, ask patients if they are hungry, B, ask about dietary restrictions, C, check each armband and diet order, even on familiar patients, D, check the temperature of the food. Oh, Charmaine and Jay and Marie and Rose, you were fast with this one. That's right. Those diet orders can change. And so it's going to be C. Verifying patient identity ensures that the correct meal is served to the correct individual, preventing errors such as allergic reactions or dietary violations. Look, if that pressure starts going up or if a test comes back and it shows that they have a cardiac issue, they're automatically going to be placed on a cardiac diet. What does that mean? Low salt, low fat, low cholesterol. And so you always want to be checking the orders and also checking your patient's identifications. Question number 9. D. Nursing aides should always wear clean uniforms, comfortable nursing shoes, and socks or hose without runs. So I don't even know if you all know what hose are, but those compression stockings, it's going to be D, you all. We need you to look like what you want to become. You're going to be professional. So professional appearance is essential in healthcare settings. Clean uniforms, appropriate footwear, and tidy accessories contribute to hygiene and professionalism. Look, you can show your personality on the weekend. You can get your press-on nails on the weekend, but when you come to work, I need you to look like you came to work, not to be an Instagram model. Question 10. A resident complains that his children never visit. The nurse aide should A, tell him that they will come soon. B, tell him not to worry, it will be all right. C, listen with empathy. D, tell him that he should have been nicer on the last visit. Ouch. That's right, pretty girl. Yes, it is C. We're going to listen with empathy. Providing a listening ear shows compassion and support, which can help the resident feel understood and valued. Number 11. A patient appears more pale than usual. The nursing aide should A, note it on the chart, B, ask the patient how he feels and take his vital signs immediately, C, get the patient a snack, D, offer a glass of water. Your patient appears more pale than usual. And as a nurse, when my CNA, when my tech tells me anything about my patients, I get my butt up. I get up and I assess, because guess who spends the most time with the patients? The CNAs. So you're going to be able to tell us when something changes, when something isn't right. And you may not know what's wrong, but at least you can say, hey, Eunice, his complexion, he's pale, and I'm going to get up and I'm going to assess. Because yes, you all, we need to get those vital signs done. So a pale appearance may indicate a serious condition like low blood pressure or anemia. Maybe they're post-op and they're losing blood. So assessing vital signs help to determine the severity of the situation and allows for prompt reporting. So great job, CNAs. We need you because you help keep those patients safe. Question 12. At the end of the shift, some nurses' aides go to a restaurant. Acceptable topics of conversation would include A, their patients, B, procedures that others in the restaurant might not want to hear about, C, hospital politics, or D, the weather. Yeah, I know that's a boring topic, but yeah, you can't violate HIPAA. And you never know who's listening. So you can talk about the weather, you can talk about sports, but you cannot talk about the patients, the procedures, or who pissed you off on the shift. We do not talk about hospital politics. So it is unethical and unprofessional to discuss patient information or hospital details in public settings, as it violates patient confidentiality and privacy laws. General topics like weather are appropriate for those conversations that are in the public. 13. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient A has diabetes, B had breakfast, C had visitors that day, D ate too much sugar. This one's a bit tricky. We're torn between A's and B's. It's about 50%. Now, I want you to think about this. They received insulin. What type of patients receive insulin? Diabetics, right? So it's not A. We already know the patient has diabetes. What we don't know is B. Did they eat breakfast? That's why they, maybe are having those symptoms. So symptoms like paleness, sweating, and confusion could indicate hypoglycemia, low blood sugar. It is crucial to know if a patient ate breakfast after their insulin dose, as skipping meals can lead to dangerously low blood sugar levels. So, all right, so about 50 of you all got that answer correct, and I'm so proud of you. Question number 14. A resident's daughter expresses concern because her father, who has Parkinson's disease, appears stuck at times and stands still, unable to walk. The nursing assistant should tell the daughter that A, her father has likely had a stroke, B, he is confused, C, that is a common sign of Parkinson's disease, D, he just doesn't feel like walking. And I see you, Jacqueline. All right, while you all are putting the answer in the system, congratulations, Jacqueline, on passing your exam. I'm so proud of you. All right, so whenever someone has Parkinson's, it's not that they're confused, you all. They don't necessarily have dementia. So it's going to be C. I need for you to know that freezing, not being able to walk sometimes, getting stuck in a position, unable to initiate movement, those are common with patients who have Parkinson's disease. So providing this information reassures the daughter and explains the condition symptoms. And when you're taking care of someone and you don't understand, you refer that daughter, that family member, that visitor to the nurse. Okay. So you don't usually do the initial teaching, you reinforce. And it sounds like that daughter needs to speak to the nurse instead of speak to the CNA. Question 15. A resident is standing in the hallway holding a bag and asks the nursing aide, when is the train due? The aide should tell her A, that she is being ridiculous, B, where she is, C, to go back to her room, D, that it should be there anytime now. Miss Lucas, you just sit down. The train is coming. D is evil. So don't do your patients like that. Kana or Kona. Yeah, you can't do D, you all. No. You're going to remind her where she is. The answer is B. So responding in a calm, factual manner helps orient the resident without dismissing or invalidating their feelings, which is particularly important when dealing with someone who has dementia or confusion. And so, we're hey, Miss Lucas, I know you said that the train is coming, but right now you're at, your home, you're at ABC facility, and I'm Eunice. I'm your nurse. I'm your CNA today. Is there a reason why you want to get on the train? And that is how you can kind of change the topic, because maybe she's getting on the train because she wants to go have lunch, and you can just walk her to the break room or the lunch room. Question 16. On what side should a patient lie for an enema? Is it A, right, B, left, C, whichever side is more comfortable, or D, the side closer to the restroom? And so if I had never taken this test before, if I was a nurse, I would definitely choose D, but D is wrong. That is right, everybody. It is B, the left side. So the left lateral position is recommended for enemas because it allows the rectum and colon to be in the most natural alignment for the enema solution to flow effectively. And as a CNA, you don't give medications. But what's going to happen is I'm going to say, hey, Sydney, I have an order. I have an order to give Mrs. Lucas an enema, and I'm going to give it to her in about 20 minutes. And so, Sydney, your job would be to put extra pads on the bed to make sure there is maybe a bedside commode or a bedpan in the room. And then, if possible, leave that person on their left side. And that way, when I come in as the nurse, I can give them the enema. I'm going to tell them to try to hold that solution for as long as possible. I'm going to give them the call bell or the call button, and they're going to call you whenever they feel the need to actually have a bowel movement. And so that is why we're telling you that we're going to be giving an enema or a suppository, because we want to make your life easier so you can pad that bed and get the patient into position. All right, let's go to number 17. And if you hearing me read these questions helps you to understand the questions better, to pick the answer, do not forget that when you take your CNA examination, you can request an audio test. They'll give you an earpiece that only you can hear out of, and it's going to read the questions and the answers to you. So you have to speak to your instructor, speak to your school, and let them know that, hey, I think I'm going to do better with the audio headpiece. All right, so question 17. What is the best way of keeping a skilled nursing facility from having an unpleasant odor? Is it A, keep all the windows open? B, use an air freshener regularly? C, empty bedpans and change linens in a timely manner? D, there is nothing you can do because all the nursing homes just stink. There's nothing we can do about that. And that's right, you all. We're going to empty those bedpans, change the linens, and take out that trash. Don't leave that stinky stuff in the patient's room. So C is the correct response. Preventing odors requires proactive hygiene measures, such as promptly emptying bedpans and soiled linens. Air fresheners only mask odors, plus they can actually cause someone who has asthma. It can irritate them. So your facilities usually don't have air fresheners. And we're not going to open a window because that's not a reliable solution. Plus, it can let bugs in. Number 18, a nursing assistant notices red marks on a resident's back and buttocks. The aide acts in the knowledge that A, red marks are not a problem. B, the skin can break down if nothing is done. C, patients can only be turned every 2 hours. D, it takes a doctor's order to rub skin with lotion. So in other words, which of these is true and factual? Okay. Which would a knowledgeable CNA actually do? Or no? And that is right. You have it. It is B. Look, we know that red marks would indicate that the skin could be breaking down. So red marks are an early sign of pressure sores. If not addressed by turning the patient and relieving pressure, the skin can break down, leading to ulcers. And as I say in almost every one of our videos, a pressure sore looks different on lighter or fair-skinned people than it would on a darker-skinned person. And so for a Caucasian person, it would be redness. For a brown-skinned person, maybe they are an Indian, Latino American, African American, African, we're not going to turn red. It could be purplish. It could be darker. It is discolored. So if someone has discoloration, especially over a bony area, that is a sign of a pressure sore, and you should let your nurse be made aware. And while you're waiting for the nurse to come into the room, go ahead and reposition them. Question 19. A patient complains that her hands hurt where the IV is running. The nursing assistant notices that the hand is puffy. The best thing to do is A, notify the nurse that the patient is complaining of pain. B, reassure the patient that needles always hurt. C, put ice on the hand. D, notify the nurse that the effusion appears to have infiltrated. Oh, we're torn between A's and D's. A's and D's. What do you think, team? And now we have a B. So while A isn't wrong, it doesn't say where the pain is located or what the pain is actually associated with. You all, when someone has an IV, and the area with the IV starts to hurt and is puffy, that means that those fluids are no longer going into the vein. They're going into the surrounding tissue. And so while A is not wrong, D is the best response because it's going to get that nurse in that room a lot faster. And so D it is. If you chose D, give yourself a round of applause. So puffiness and pain around an IV site suggests infiltration. Again, the fluid's not going into the vein, it's going into the surrounding tissue. The term you're going to hear us say is infiltration. And so the IV nurse must assess and address the issue immediately. So if you tell me someone has pain and I'm like, oh, that's pain in their leg, that's a cramp. Versus you say, hey, Eunice, the hand is puffy and it hurts where the IV is, that's going to get me in that room a lot faster. So you're going to have to learn how to actually give a report that gets the nurse in the room a little bit quicker. Number 20, and we're going all the way to 50, family. So number 20, a nursing assistant walks into a room and sees that the patient does not appear to be breathing. Oh, Lord. The first thing the aide does is to A, leave the room, to call the CPR team. B, shake the patient's shoulder while shouting his name. C, hit the patient's chest. D, tilt the patient's head back and give 2 quick breaths. Oh, we're torn between B's and C's. I can't believe how many of you all are choosing C. Don't be hitting that person in the chest. That's right, you all. You're going to tap and shout on the shoulders. So it's like, hey, are you okay, with your hands on both shoulders? So the answer is B. The first step is to check for responsiveness by shaking the patient gently and shouting their name, not by hitting them in the chest. This determines whether the patient is unconscious before proceeding to further actions. Okay, and so I see all these great responses coming through. Now that we've tapped and we shouted and we did all of that in less than 10 seconds, and this person hasn't moaned, their chest isn't rising, they're not breathing, what happens next? Put it in the chat. What happens next? That was 10 seconds. You did a quick assessment. Hey, Mr. Lucas, hey, are you okay? Are you okay? And you're looking at the chest and nothing's moving. What do you do now? Almost, Bindu, almost. All right, so Bindu says CPR, but remember, you are part of a team. Yes, you have to call for help. You got to press that code button, get the nursing team in the room. And after you call for help, you can start CPR. So you all are correct. I just need you to make sure that you know the correct order. If you don't call for help, your team is not going to come. You're going to be exhausted and are doing CPR all by yourself. And at some point, this patient is going to need some breaths. And we do not perform mouth to mouth on our patients. We use equipment to give breaths. And so hopefully they've taught you about that in your CPR class. If not, you'll learn about it whenever you're in an emergency situation. But yes, you're going to check for responsiveness, call for help, shout for that AED, and that's when you can begin high quality chest compressions. But we normally reserve the breaths for when the crash cart comes. And when the crash cart comes, that's when we can use the bag mask device to deliver the breaths. Don't use your mouth. Question 21. A patient complains of feeling short of breath and nauseated. Her face is rapidly turning red. She tells the nursing aide that she didn't know there were strawberries in the gelatin she ate. The nurse aide should A, note on the chart that the patient appears to be allergic to strawberries. B, tell the patient that fruit is good for you. C, take the tray away. D, notify the nurse immediately. Everybody got this one's right. Yes, it is D, everybody. That's a medical emergency. That patient needs some epinephrine. So it is D. These symptoms indicate an allergic reaction, potentially anaphylaxis. So prompt notification of the nurse ensures the patient receives urgent medical intervention. The other things, such as putting on her chart that she's allergic to strawberries, all of that can be done once we get this patient stable. Are you proud of yourselves? Because I'm so proud of you. All right, question 22. Let's talk about those body systems. The brain is part of the A, locomotor system, B, endocrine system, C, nervous system, or D, exocrine system. And Ramatula, I see you. You're answering all the questions correct. And yes, everybody, it is C, the nervous system. So the brain is a control center of the nervous system, which includes the spinal cord and nerves. It coordinates all body functions and responses. Well, let's go back to CPR. So the reason why we need you to pump hard and fast, so at least 2 inches at a rate of 100 up to 120 compressions per minute. The reason why we have these parameters is so that you can make sure that there's adequate blood flow to the brain. So if your CPR quality is ineffective, you're doing a whole bunch of pumping, but the brain is not getting any blood. And that's how people end up brain dead or in a vegetative state. And so you just doing CPR, but not doing it intentionally, hard and fast. Think, I gotta send blood to the brain. I gotta send blood to the brain. So take your CPR courses seriously and stop trying to rush through it just so you can go back to work. All right, rant over. Question 23. Which of the following causes the most infections in healthcare facilities? Is it A, airborne bacteria, B, unwashed hands, C, contaminated food, or D, sick visitors? All right. Which causes the most infections in healthcare facilities? I need everyone to get this right. And did, yes, unwashed hands. So unwashed hands are the leading cause of infections in healthcare facilities as they facilitate the spread of pathogens between patients, staff, and surfaces. Proper hand hygiene is the most effective way to prevent infections. When you're taking your CNA exam, that clinical exam, you have to wash your hands before and after care. So if you have to perform 2 or 3 skills, in Florida it's 3 skills, you're washing your hands before and after each skill. 24. Continuing education is A, necessary for recertification in many states, B, important for keeping abreast of new developments, C, a professional standard, D, all of the above. And so when you think of continuing education, think of those classes on HIV and AIDS, on domestic violence, on fall safety. Why are those classes important, you all? That's right, everybody. Christina and Rose and fire. Yes, it is D, all of the above. Continuing education is vital for maintaining certification, yes, but it also helps you stay updated on advances in healthcare, and it allows you to meet professional standards to provide high quality care. 25, the halfway mark. There's an order to give the patient a shower, but she refuses. The nursing assistant should A, take the patient to the shower anyway. B, tell her that she must do what is ordered. C, document in the chart that the patient refuses to shower. D, threaten to use restraints if she does not cooperate. Man, if you do D, you want her to shower awfully bad. The patients don't want to shower all the time. Number one, they're cold, and then you go put them in the shower, and when they get out, they're going to be cold. So guess what? They don't want to shower. And so we're not going to threaten them. Instead, you're going to document. What would you document besides patients refuse? Because that doesn't protect you. Think about it. So yes, patients have the right to refuse care, including showers. The refusal should be documented to inform other staff and ensure proper follow-up. But the patient's autonomy must be respected. All right, so I'm your nurse. This patient has refused to shower. You document it. But what did you not do? You have to go back and communicate. So make sure that when you document that you have actually told the nurse. And in your documentation, you would say nurse notified. Because if you just do something and don't tell me, well, when the family comes fussing, I'm like, why are the family fussing? Marcus gave this bath. So you have to tell me, okay? And so maybe instead of giving the patient a shower, maybe we can do a sponge bath for that day. All right, number 26, side rails should be up if A, there's an order to that effect, B, the patient appears confused, C, the patient is unsteady, D, the patient is in bed without a staff member standing directly at his or her bedside. This one's tricky. This one is tricky. It's not tricky for Robin Smallwood. It's not tricky for Azure. Tacoma says A. So yes, everybody, not all of your facilities require side rails. And so in your nursing homes, assisted living facilities, if that patient's not a fall hazard, there may not be an order for a side rail. So side rails have to be ordered. So the correct response is going to be A. Rationale. Side rails should only be used according to physician's order or facility policy to avoid unnecessary restraint or restriction. They are used to ensure patient safety, but must comply with legal and ethical standards. So in a lot of your facilities, the upper two side rails, they will be on the bed for repositioning. But if you decide to raise all four side rails without a doctor's order, that is a restraint. And so you'll be following your facility's policies. But if you feel that a patient needs four side rails up, that's a conversation you're going to have with the nurse, who will have to call the doctor to get that order. Otherwise, it's only two side rails, or none if you're in ALF or in the nursing home. Let's go to our next one, team. Question 27. A patient suddenly complains of feeling weak on one side while he is getting a bed bath. The nursing assistant should A, tell him that weakness is normal at his age, B, prop him up with pillows, C, report this to the nurse immediately, D, pass it on at the end of the shift. And I know that you all are very conscientious caregivers, so you're going to choose the best response, the response that is the best for the patient. Okay. That is right. If there's a change in condition, we're notifying the nurse. All right. And so this person, weakness on one side, put it in the chat. What type of condition or medical emergency could this person be suffering from? Put it in the chat. What do you think, team? Sudden weakness on one side. Yes, Jennifer, they could be having a stroke. And so everybody, the stroke assessment is fast. So whenever you're thinking someone's having a stroke, I need for you to think fast. F, look at their face. Does it have any drooping? Is it asymmetrical? Sometimes they could be drooling out of one side of their mouth. Automatically, you're calling for help. If you're in home care, you're calling 911. Now let's keep going. A, ask them to raise their arms. And if one arm doesn't raise, guess what? That is also a sign of a stroke. You don't have to go through the whole FAST before you call 911. If someone's had a change, you can go ahead and, alert your nurse or call 911 if you're in home care. S is going to be speech. Their speech is probably going to be slurred. It's going to be slurred. It's not going to be normal. T, time to call 911. So fast, face, arms, speech, time to call. In your facilities, you'll press the code button to get the nursing team in the room, and the nurse will usually call the code stroke. 28, a patient asks for an extra pat of butter from an aide who is unfamiliar with her. The aide should A, get her some butter, B, check what kind of diet she is on and give the butter if she is on a regular diet without fat or calorie restriction. C, refuse, telling her that butter is not good for anyone. D, give margarine instead because it is better for her. And those patients are feisty. And when they know that you're a newbie, they're going to be asking you for things that they know they can't have. So, yes, it's going to be B. The nurse aide must verify the patient's dietary restrictions before providing food to ensure it aligns with her prescribed care plan. 29. A patient allowed to have a glass container of flowers in her room, B, a leather belt, C, a mirror, D, pictures of her family in an album. And your patients who are, have sight conditions, emotional distress, they're on every unit. So even if you're on a med surg unit, at some point, you're going to take care of somebody who has suicidal ideation, suicidal thoughts. And so you have to do a pat down. You have to go through all of their personal items to make sure they don't have anything to hurt themselves or to hurt you. And so the safest thing for that patient to have would just simply be photos. So the answer is D. Patients on suicide watch should only have safe, non-harmful items in their rooms. Family photos can provide comfort and support without posing a risk. Number 30, a patient chokes while eating. The first thing the nurse assistant should do is A, attempt to remove the obstruction, B, call for a licensed person. In other words, you're going to call the nurse. C, slap the patient between the shoulder blades. D, tilt the victim's head back and give 2 quick breaths. So this patient's choking. Hands are clutching their throat. They're doing the universal choking sign, and you're standing there looking at them. What are you going to do? Are you going to do A or B? Nope, we don't do the slaps between the shoulder blades. I think the AHA just recently changed that, but we're going to go with the previous standard. So if you slap them, it can actually make the food go down to their lungs. And so we usually do back slaps with infants, not with adults. And so if an adult is standing and you hit them in their back, you're going to make the food go into the lungs. So instead, it's going to be either A or B, and let's see what the consensus is. Yes, everybody chose A. You're going to do this abdominal thrust, aka the Heimlich maneuver, and scream out for the nurse. But you have to do something. You have to act. You're just not going to stand there, look at a person who's choking, and call for the nurse to come into the room. So you're going to be doing the Heimlich and call a nurse into the room. So the priority is to clear the airway by performing the appropriate maneuver, such as the abdominal thrust, aka the Heimlich maneuver, if the patient is choking and unable to speak or breathe. All right, let me add something to that, you all. Your patient's obese. You're working on the bariatric unit. This patient's 500 pounds and you are 100 pounds. You cannot get your hands around her stomach. How do you get that patient to help themselves relieve their airway? They have to help themselves. You're screaming out for help, but you're 100 pounds and she's 500. Your hands are not going to go around her stomach. So what would you do? Oh, yes. Bandu said, what? Yes. So when you work on certain units, they have bariatric units. The bariatric units are for obese people who may be undergoing weight loss surgery. And so when you have somebody who's obese and you are petite, if they start choking, you got to figure it out. So what are you going to do? I love you too. Alicia says, I love you. Christiana says, call for help. All right. So you can try to get that person to help dislodge their own object by maybe ramming their stomach into a table or a chair. You can also do chest thrust versus abdominal thrust. So if you can get your hands under their arms and go into the center of their chest, that is something that you can do also. But yes, you're going to be screaming for help. You can only do so much by yourself. Let's go to our next one, team. Let's see what question we're on. Question number 31. Yes, that's right. I know you meant to say bend, but yes. Yep, we're going to help them help themselves. So 31, a patient who has been depressed and complaining of feeling hopeless suddenly appears happier one morning and says that everything is okay now. A good nursing assistant, A, congratulates the patient on getting better, B, watches more closely, C, voices concern to the rest of the staff. D, B, and C. You know what? All is well. I feel so much better now. I think it's time for me to go home. That would scare the ham and cheese out of me if I heard a patient who, was depressed and they started talking like that. And so, yes, everybody, you have to alert the staff because it's going to be D, which was a combination of B and C. A sudden improvement in mood can indicate that a depressed person has decided to act on their suicidal thoughts. So close observation and communication with the team are essential for patient safety. Look, we cannot let our guard down, especially in these facilities. There was a teenager who was supposed to have a sitter at a hospital, and this happened maybe a month ago. And she had been in the hospital for a few weeks. And when they let their guard down, she slipped into the elevator and she jumped from the parking garage. So I'm sorry, if they're supposed to be watched, we have to watch them, okay? And I know it's only so much you can do as a CNA, but don't let your guard down around someone who's depressed and has suicidal thoughts or ideations. Question 32. The circulatory system consists of A, heart, arteries, veins, and capillaries. B, blood vessels, arteries, veins, and capillaries. This is a lot. C, heart, artery, pulmonary vessels, and lungs. Or D, blood vessels, lymph nodes, and spleen. Letitia, good luck on your test. All right, keep us posted. I know you're going to do well. And thank you for purchasing the book. Yay! All right, so the circulatory system. Yes, everybody, it is A. So I know that was a tricky. It wasn't B because when it just mentioned blood vessels, it wasn't specific enough. So heart, artery, veins, and capillaries. So the circulatory system is responsible for transporting blood throughout the body and includes everything I just mentioned. 33. It is important that dressings remain A, tight to keep out bacteria, B, loose to admit air, C, clean and dry, D, untouched until ordered removed. So we have a new patient. They had their surgical procedure. They're on our floor. How do you want their dressing to be? What would make you happy? Because if it makes you happy, it makes me happy too. That's right. We want C. We want it clean and dry. So that means if they have a bowel movement or something and there's some fecal matter, some urine on the dressing, because patients have, especially if they had a wound, that means that surgical dressing is on their buttocks or their coccyx. And so when you see something that doesn't look right, you have to notify me because we expect for dressings to be clean and dry. So keeping dressings clean and dry helps prevent infection and it also promotes healing. Wet or dirty dressings can harbor bacteria and delay recovery. 34. Drainage bags from urinary catheters should always A, be kept below the level of the bladder, B, have clear urine without sediment, C, be irrigated daily, D is A and B, or E is all of the above. Let me give you a few seconds on that one. I know that one was a little bit trickier. When someone has a drainage bag, what can a CNA do? What should a CNA expect? Oh, we are A's, B's, D's, and E's. All right, reveal the answer in 3, 2, and yes, it is D. You cannot irrigate the catheter. That is not a CNA's role. So, and as a nurse, if I have to irrigate it daily, something's wrong. I need to be calling the doctor because that means that this person's output is really thick. And so usually irrigation only happens after some type of bladder or prostate surgery. So that's not something you would regularly see. So yes, the answer is going to be D, because we expect the urine to be clear without sediment, and we also expect for that drainage bag to be below the level of the bladder. That will reduce the risk of infections. 35. A patient tells a nurse's aide that the foods on her tray conflict with her religious beliefs. The nurse aide should A, tell the patient that that is all that is available. B, leave the tray there in case she changes her mind. C, check the patient's religious preference on the chart. D, take the tray away and notify the charge nurse. Yes, I'm so proud of you. Can I tell you how it just hurt my heart? We had this one patient, this was years ago, and they were on a kosher diet, and somehow for breakfast, they ended up with pork on their tray. Now, okay, the patient was really calm. Guess what happened during lunch? He ended up with another pork product. When I tell you that I was livid, why was I livid? That means because for 2 meals, a patient who, due to their religious reasons, their religious beliefs, they were given food that was not only offensive to them, but on top of that, their food was now cold or delayed. And so the answer is going to be D. When you see something that's not right, take it away and then notify that charge nurse. The nursing assistant should respect the patient's religious beliefs and dietary restrictions. Informing the charge nurse ensures that alternative meals can be arranged in compliance with the patient's needs. Look, by the time I got through with dietary, we did not have any more issues. And I'm sure that patient appreciated having a team like us because we advocated for their rights to have food that actually fit their religious preferences. 36. A nurse aide notices blood in a patient's IV tubing. What are you going to do? Is it A, notify the nurse? B, do nothing? That's normal. C, try to flush the tubing. D, stop the IV. Yes, Betty and Kona and Maria. Yeah, they're going to notify that nurse because blood in the IV tubing may indicate an issue with the infusion. And so only licensed professionals, and so not every nurse has been trained to actually take care of IVs. And so that's why it says only licensed personnel. So yes, you're a nurse, but if you haven't had IV therapy course, they may not let you touch the IV. But if you see something not normal, say something so that the right person, the right personnel, the right charge nurse can come and actually assess that patient's IV site. 37. This one's a long one. A patient calls the nurse's assistant and says, someone spilled water onto my bed. The nurse aide observes a moist area around the patient's perineum, aka their private area. The nurse aide should A, tell the patient that she has obviously had an accident. B, tell the patient to ask for a bedpan when she needs one. C, change the linens and make a mental note to offer the bedpan more often. D, ask the doctor for an order for a catheter. Tikama, I love you. You always like duplicate your letters. And everybody who puts C, you are right. Remember that whenever a patient is incontinent, CNAs don't do anything involving the catheter except for clean the catheter site and empty, measure the output. So what do you do instead? You take them to the bathroom more frequently, or you provide the bedpan more frequently. And so the answer is C. Here's your rationale. The aide should address the patient's needs respectfully. So instead of saying, Miss Lucas, ain't nobody spilled water in the bed. You wet yourself. All right. She's embarrassed. That's why she told a fib. So you're not going to say that. Instead, you're going to say, all right, Miss Lucas, let's get you on the bedpan more frequently. I'm going to help clean you up. Let's get this water off of you. So clean up the area and monitor the patient to prevent future incidents without causing embarrassment. 38. In report, the nurse's aide is told that one of her patients has been ordered NPO after midnight. The nurse aide should A, take away the pitcher at midnight, B, offer frequent snacks, C, note all water the patient drinks and all output, D, ask the patient if he is having any pain. They want to know if you understand what the abbreviation NPO stands for. So when someone has an NPO status, what does that mean? And the nurse goes, wow, because 90% of you all chose the correct response, which is A. That is right. NPO means nothing by mouth. And because this person is NPO after midnight, they must be having a procedure the following day. Okay. So NPO means that the patient cannot eat or drink after a specific time, usually for medical procedures. Ensuring compliance with this order prevents complications. So you just don't take the water pitcher away and move it to the other side of the room. Take the water pitcher away and empty the water pitcher. Okay, that way if they're ambulatory, they won't be tempted to get up and just sneak a little bit of water in the middle of the night. 39. A patient is leaving the hospital. The family has been told to give her medications BID. The wife asks, what does that mean? The nurse tells her to give the medication A, twice a week, B, 3 times a day, C, twice a day, or D, only when needed. So what does BID stand for? And don't forget, if you aren't one of our channel members, you should have access to this. And so how do you become a channel member? You go to our channel, Florida Training Academy, which is on YouTube. And if you haven't subscribed, subscribe. And then you're going to see an option that says join. You can join for $4.99, and then you can get these slides. And we try to give you a new digital download once per week. And we also have member-only content. All right, so let's go, everybody. Let's see what the correct response is to number 39. And yes, you have it. It is C. Great job. So BID is a medical abbreviation derived from Latin meaning twice a day. Clear communication ensures the patient receives medications as prescribed. And while you as a CNA, you don't give the medications, you have to know what these abbreviations mean, because there may be an order to maybe change a dressing BID, and the family member says, hey, how often do we change the dressing? And that way, when you look at the chart, you'll understand what that means. 40. While taking a rectal temperature, the nurse's aide should insert the thermometer and A, stand outside the doorway, B, hold onto the thermometer until it can be removed, C, take care of other patients and return in 3 minutes, D, stay in the room until it's time to read the thermometer. And I know we rarely do rectal temperatures, but if you're working in a critical care area, or if you're taking care of somebody who possibly has hypothermia, maybe they drowned, we can't do an oral temperature. We can't do an axillary temperature because their body's so cold. So we have to do an internal temperature. We're going to do a core temperature. They're going to need a rectal temperature. And now what do? Do you just insert this thermometer in a rectum and leave? Absolutely not. It's going to be B. You're going to hold it for the minute. That's usually how long it takes until it beeps and it registers. So holding the thermometer prevents it from slipping out, ensures accuracy, and avoids injury to the patient. I want you to look at your pinky. All right, so everybody, look at your pinky. That's 1 inch. That is how much of that lubricated tip is going to go into that person's rectum. So I don't care if the thermometer is 4 inches, you only put the tip into the person's rectum, not the full thermometer. Question number 41. Before performing any procedure, a nurse's aide must A, identify the patient, B, wash your hands, C, explain the procedure, D, all of the above. That's right. Getting you ready for your CNA examination. Because when we start off like this. Let's go ahead and practice. Hello, my name is Eunice. I'm your CNA today. I'm here to take you for a walk. Is that okay? And so during your test, you may not know your patient's name, your partner's name, but in the real world, when you enter the room, you just don't want to say, "Hey, are you Margaret, Garcia?" You're going to look at their armband, because if they're confused, they're going to say, "Yes, I'm Margaret Garcia." So after you've cleaned your hands, you can begin your skill. So keep practicing with your introduction. And if you need to, learn how to do an introduction from start to finish, we actually have a clinical skills video on our channel that not only covers all the skills, but it goes through the introduction and the exit. So let's do that again. Hello, good morning. Can you tell me your name? Verify the ID. Yes. So Ms. Garcia, my name is Eunice. I'm your CNA today, and I'm here to take you for a walk. Is that okay? You got their permission? Before I begin, let me go wash my hands. Question 42. A patient has a diagnosis of psoriasis. Her nurse's aide should A, avoid contact with the highly contagious lesions. B, wear gloves for patient care. C, treat her the same way as any other patient with a non-infectious disease. D, wear a mask when entering the room. So is psoriasis contagious? What do you think, team? I see some mixed responses there. I love you all. So many of you all chose the right answer. And you're not wrong for choosing B, but we want you to know that psoriasis is non-infectious. It's just a skin condition. It's kind of like having an itchy area, patchy area of skin. So psoriasis is not contagious, so standard care should be provided without extra precautions unless the patient has a secondary infection. However, look, I know when we see somebody who has something abnormal, we're going to protect ourselves because we assume it's psoriasis, but it could be something else. So if you chose put on gloves, you're not wrong. But once the doctor has the diagnosis on the chart as psoriasis, then you can just treat them, as you regularly would with somebody who had a dry patch of skin, on their body. 43. Which of the following will not put undue strain on the back? A, crossing one's legs. B, lifting the legs. C, slouching. D, twisting the back while moving patients. I had to push somebody in a wheelchair today. My back hurts. I know we're supposed to start today at 7, but doing all that care, it hurt my back. So try to protect your back. Use proper body mechanics, but this person just didn't have the best wheelchair. And so, yes, whenever we're lifting, we're going to do B. We're going to lift with our legs, those strong leg muscles. So proper mechanics, such as lifting with the legs instead of the back, helps to reduce the risk of back injury. 44. Which of the following is not true of blindness? Which of the following is not true of blindness? A, most legally blind or visually impaired people have no sight at all. B, diabetes is an important cause of blindness. C, always identify yourself before touching a blind person. D, ask if a blind person needs help before giving assistance. So you're choosing the one that is false. Which of the following is not true of blindness? Which of these options is incorrect? Yeah, we're torn. We have C's, we have B's, and I see an A. Let's wait for a few more people to respond. Did you all know, and let me say allegedly, that allegedly Stevie Wonder can see? And yes, you'll have someone whose chart indicates they're legally blind, but they can still read newspapers. So when someone is legally blind, it doesn't mean that they have no sight at all. So the statement which is not true is A. The others are true. Diabetes can cause blindness because of the capillary damage, the blood vessel damage. You're going to, because if they can't see you, you're going to have to use your voice whenever you go into the room. So it's going to be C. You're always going to identify yourself before you touch a person who's blind. And then you don't want to assume that they need your help. You're going to ask because a lot of them are super independent. So you're going to ask if a blind person needs help before giving assistance. And so that is right, team. A is the incorrect response because many legally blind individuals have some degree of vision, such as light perception or limited field of vision. 45. Which of the following is not true of dementia? A, people with dementia act uncooperative to be spiteful. B, patients can have hallucinations. C, people with dementia are often frightened and anxious. D, grooming is difficult for patients with dementia. And again, which is inaccurate, which is not true. I've been watching you, Tacoma. You have gotten so many answers right. Great job. All right, everybody. The correct response is A. When someone has dementia, they're not being uncooperative to be spiteful. They're just not doing it to make your day worse. So that is not true. That is a misconception. Uncooperative behavior in dementia patients is not due to spite, but is due to confusion, fear, or frustration caused by the cognitive impairment. 46. Which of the following is associated with smoking? Is it A, pneumonia, B, heart attacks, C, vitamin C deficiency, or D, all of the above? If you all can see my smile, I'm smiling over here because like 100% of you got the answer correct. It is D, all of the above. So smoking increases the risk of respiratory infections like pneumonia, cardiovascular issues like heart attacks, and nutritional deficiencies such as vitamin C. Let's see, Mrs. Ray. Hello, I passed my written test. You're so welcome. Skills test in 2 weeks. Yes, we're going to pray for you, and yes, you're going to pass that too. Look, if I ever get sick and hospitalized, I know wherever I am in the world, I'm going to get some great care because of great people like you all. So proud of you. Let's keep it going. We're on question number 47. Most of our calories should come from which of the following? Would it be protein, fats, carbohydrates, or vitamins? Think of the food chain. Most of our calories should come from what? Whether you agree with it or not, just pass your test. All right, that is right, team. The answer is C. And for those who try to cut back on our carbs, we know that, yeah, for us, we're not going to eat a whole bunch of carbs, but pass your test because if you're still going by the food chain, carbohydrates are the body's primary energy source and should comprise the largest portion of a balanced diet. 48. Bloodborne infections include A, hepatitis, B, pneumonia, C, shingles, D, urinary tract infection. Which of these would be considered a bloodborne infection? Great job, great job, great job. It is hepatitis. So bloodborne pathogens like hepatitis viruses are transmitted through blood and bodily fluids, unlike pneumonia, shingles, or urinary tract infections. 49. Diabetes is A, common, B, often associated with obesity and sedentary lifestyle, C, controllable, D, all of the above, E, none of the above. We see A's, We see B's. I see a C and I see a D. Do we have an E? So for all of my D's, you have it. Yeah. So diabetes is prevalent. It's quite common. Why? Because especially in America, we're overweight and we have sedentary lifestyles. Sedentary lifestyles means you're not getting up and moving. You're not getting those 5 to 10,000 steps in. You're sitting at a computer all day. And yes, it can be managed through medication, diet, and exercise. So all of the above are true. So the answer is D. And in question 50, we got one with our vital signs. A CNA measures a resident's blood pressure at 82/48 millimeters of mercury. The resident appears pale and weak. What is the best next step? A, help the resident back to bed and notify the nurse. B, give the resident a glass of water. C, wait and recheck the blood pressure in 30 minutes. D, have the resident walk to increase circulation. Blood pressure 82/48. That's pretty low. It's low enough where that patient's going to hit the floor. So yes, everybody who chose A, you are right. Let's get you back in bed. As a matter of fact, we need to dangle you. We're going to see you over the side of the bed first. And whenever the patient stands or while they're sitting upright, if they verbalize any dizziness, you get them right back in bed. But when a person's blood pressure is low, they don't have enough perfusion to the brain. They can become faint. So don't get them up, have them in the bed, call the nurse. If they happen to be up because they are walking and they start feeling faint, well, you may not know what the blood pressure is, but you're going to assume the blood pressure dropped. That's called orthostatic hypotension. You're going to ease them to the floor, make sure that you try to protect their head, keeping them upright, and you're going to be screaming for the nurse. So scream nurse or scream help. And someone's going to come to you and we're going to do a team lift to help get that patient to safety. Whether we're putting them in a chair, a wheelchair, and whisking them back to their room, or actually putting them on a stretcher. But you are not alone. You have a full team as long as you vocalize and let us know that you have a need. And guess what, friends and family? Yes, that answer was A. And we did it. We got all the way to the end. And for those who were here in the beginning, you know that our new CNA book is out. And so thank you all for supporting us. We appreciate you all so much. We're here to help another 100,000 people pass their examination. Look, we've been doing this for so long now. We literally wrote the book on how to help CNAs pass the test. And so just scan the QR code or go to the website that's scrolling across the bottom, nurseunits.com, and you can actually purchase our CNA Exam Prep book. And girl, you are so welcome. You know how much I love you. Oh, you got until December 23rd. All right. And so we have somebody who has questions. You can go ahead and put your question in the chat. And so let's see here. My teacher told me today, don't watch YouTube channel. We tell our students the same thing. We say, don't watch YouTube. But so you can go by what your teacher says as long as they have something for you to watch. But our videos haven't steered students wrong, and they've been passing their tests globally. So just keep that in mind. Tell your teacher to watch our channel. All right. So if you haven't done so, you all go ahead and like, share, and subscribe. And I'm going to stick around. I'm going to answer those questions because one of our babies said they have questions. For those who have to go, thank you for watching. For those who have questions, let's go ahead and put them in the chat. You're so welcome, everybody. All right. Let's see what questions you all have. All right, so how many questions can you miss on the real test? It's not about the number of questions you can miss, it's the category of the questions. And so let's say on your test that you only had 5 questions that dealt with safety. So in Florida, we have 60 questions on our test. 10 are just for future testing purposes. So only 50 have weight. And of those 50, let's say 5 were on safety. If you miss all 5 because the safety questions have more weight, you are going to fail your written test. Our students rarely, when I say our students, not just our in-house students, our students who are online, they rarely fail their written test because we're going over medical terminology. We're teaching you the care concepts. So I wouldn't focus on how many questions to get right. to really focus on understanding that medical terminology. And I watched you answer these questions. You did so well. So I know you're going to do great on your test. All right, so let's see here. Some channels can be very helpful, just like this one. Oh, look, now I'm hugging you too. All right, let's see the next one. Hey, I'm your new subscriber. I watch all your videos. I like when you're doing online questions. Thank you so much. It's just been really hard right now to get online, but I'm trying my best to come on once or twice a week. So thank you so much. And let's see if we have any other questions. You're so welcome. All right, I'm going to stick around for another 2 minutes. Put those questions in the chat. If there's something I can answer for you, I'm here to do so. I think I saw a question. How can I practice my skills? I'm struggling so much and I am scared when I take it. So when you go to nurseunits.com, we have a CNA skills kit. That is if you're practicing at home with family and friends. So you can literally open up our book, your school's book, go through the skills step by step, record yourself if you don't have a family member who can actually call out when you make a mistake. But that is how I would practice if I didn't have a partner. Get your skills kit, or you can watch our videos. But if you're nervous, you doing it, you talking it through, that's going to help you with some of that nervousness. Okay. And you can always ask your school, your instructor for some additional assistance. And this is how I would pose it. Let's say that you're the instructor and I'm the student. I would say, hey, Mrs. Salo, I'm kind of nervous about my upcoming test. Is it okay if I come and volunteer, if I can come and help you in the class? And so when you do that, it's like, oh, wow, I get free labor. And as you helping, you get to learn and revisit your skills all over again. So ask your teacher if you can volunteer and be an assistant. All right, I hope that helped you out. Let's see what other questions I missed. All right, so you don't know where to start. We just gave you a good way to start. You can get your own practice kit, or you can volunteer at your school. Hey, being new to the site, when do you go live? And I'm not consistent, Shane. I'm everywhere. I try, but we have a full brick and mortar business. So I usually try to do Wednesday night lives, but my Wednesday nights have become chaotic also. But I do post. If I have time, I will usually do a community post or turn your notifications on, and then you'll be notified whenever we're going live. Or you can go to nurseunits.com, download one of our freebies. And when you download one of the freebies, we usually send out an email blast saying, hey, we're going live at 7 p.m. Yes, we have live CNA classes, but we're located in Jacksonville, Florida. All right, and let's see. Yep, just take your time. It's easy. So whenever you get scared, you need to reach out to people like Mrs. Ray, because I'm telling you it's easy, but I'm a nurse. So when you talk to other people who've taken their tests and practice with them, it's going to calm your nerves. All right, and so Betty says, I passed my skill, but I felt the knowledge. Betty, I'm going to put our email address in the chat. I need for you to send us your test results, and we, free of charge, will analyze and send you a plan. Okay, so let's say that you failed knowing the role of the nursing assistant. We're going to help you figure out what you don't know, send you your plan. And our students, once we send that to them, they pass. So sometimes you don't know what you don't know, but we need your test results, and we need to know what you have used in the past to study for your written test. All right, so what is the best way to handle an elderly who refuses your help? Oh, they can be stubborn. So, are they refusing my help with something that involves a safety risk, such as walking? I would get my nurse involved. Are they refusing my help with putting on their sweater? I'm going to let them be as independent as possible for as long as possible. If they're not hurting themselves, I'm going to give them autonomy. But if it's a safety issue, we're going to make sure the nurse is notified so it can be documented. You can only do so much without your nurse being involved. All right, let's go to our next one. I'm in Connecticut. I'm doing my exam on the 28th. Shane, you are passing your exam on the 28th. And you are so much. Let's see here. To take the test, do you have to go to school? It depends on your state. In the state of Florida, and don't quote me on the other states, but I think there are 4 states in the nation where you can just challenge the CNA examination. What does that mean? You don't have to go to school. If you understand from videos, from personal care experiences, because you took care of grandmama, if you understand the skills, you can take the test. And when you pass your examination, you're issued the same license as someone who attended school. So Florida allows you to challenge the test, but you'll have to contact your state's board of nursing to see what the requirements are for that particular state. How will you practice the skills? Hopefully she responds, Mrs. Ray. All right. Oh, well, she wants to help you. So I need y'all to like collaborate. We got to figure this out. I love to be a part of your team. Okay. All right. So you see our email address, send us your resume and let us know what I'm putting it in here now, what your specialty is, because I would love to have Mrs. Ray, Shane, maybe you all can go live with me and we can do a practice test together, especially our channel members. So if you're a channel member, that is always available for you. I just need for you to email us so that we can get you your invitation link so we can go live together. All right, so a lot of thank yous. Let's see, that's what I'm trying to do, but I missed out on the class for this weekend. Yeah. I'm not sure how to help you, Miss Sandra. So I don't know what class you missed out on this weekend. Let's see. Do you have a list of potential employers for CNAs in Florida? Miss Josephine, baby, the door is wide open. You just got to get your license. And it's almost cold and flu season. So whenever you all go to Indeed.com, let me tell you about Indeed. When you go to Indeed, it's going to let you know the actual company. So Indeed shows you, and yeah, you can apply through Indeed, but I need you to bypass Indeed. You're going to go to Indeed to look for, CNA jobs in whatever city you're in. And then it's going to show you the company's profile. Go and apply directly at the company, not through Indeed, because allegedly Indeed has not been forwarding those applications. And so you shouldn't have a hard time getting a job if you are certified and you have your CNA license and you're flexible. The problem is sometimes you all can only work, 2 days a week. Well, that means that you're going to be limited to home care. So figure out what's best for your needs with your family. If you can do 12-hour shifts, you can apply at a hospital. If it's 8-hour shifts, you can apply at a nursing home or assisted living facility. If you only do 4 hours every now and then, that's going to be home care. So sometimes that's the hardest thing. It's not that the jobs aren't there. It's find a job that can work with your schedule. Let's see here. The CNA fast track class. I'm looking in Kissimmee. Miss Sandra, we're in Jacksonville. And so I wish we would have known. Kissimmee isn't too far away. But if you didn't make your weekend class, remember that we have our videos online. So you can still start practicing. Whenever you go to youtube.com/Florida training, you're going to see a video that says all clinical skills. Just go ahead and start practicing because our skills are not just good for Florida. They're good for multiple states. All right. And so this is the last one, you all. Nurse Eunice, your questions and skills videos was so helpful for me. I really appreciate you. Look, I'm over here smiling. And guess what, you all? Nurse Eunice is going to bed because I'm tired. All right, y'all. I love you. Have a good night. Don't forget, if you didn't pass your test, you're supposed to send those results to me. And I fib. This is the last one. I finished my class and have my certificate. I live in Ohio, but I'm from Brazil. Your videos are helping me watch your videos every day, but it's a big challenge for me. I'm so nervous. And so are you nervous because of a language barrier? What about it is making you nervous? Have you been practicing? And so, Rachel, I won't leave until you give me some more information. Tell me what makes you nervous so we can help you overcome that nervousness. All right, let's see. You're so welcome, dear. All right. So, Rachel, I'm going to hang around about 2 more minutes to answer your question. And for everybody else, Nurse Eunice is going to sleep. So, good night, everybody. Rachel, even though I'm ending a live stream, I'm still in the comments. All right, everybody. Good night.